Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to speak with you about a test called the urinary flow rate and the bladder ultrasound examination. In this brief video, I'm going to define the procedure, tell you why we do the procedure, and what to expect before and after the procedure. The urinary flow rate is also called the uroflorimetry. It's a non-invasive test done in our office to measure the volume of urine that's excreted and the time that it takes to get the urine out of the bladder. The purpose of the study is to determine the presence or absence of urinary tract obstruction, or if there is a weakness of the bladder that is failing to expel urine from the body to the outside of the body into the toilet. The procedure is used to diagnose and monitor patients with urinary incontinence, patients with enlarged prostate glands, or patients with a condition called urethral stricture disease. Now, what should you do prior to the procedure? You should consume several large glasses of water approximately 1 hour before you come to the office for the procedure. You want to have your bladder as comfortably full as possible prior to the procedure. You will then be escorted into a room that contains a large funnel, and you will urinate over the funnel in privacy, and we will measure the volume of urine that comes out and the time that it takes to expel that volume of urine from the bladder. The results are calculated immediately, and you will have the results of the study before you leave the office. The test that is performed after the ultrasound exam, the test that is performed after the urinary flow rate, is the ultrasound examination. The bladder ultrasound exam is used to determine the volume of urine that is left in the bladder after the flow rate. This is used to determine how efficient the lower urinary tract is, and the test is a non-invasive test that is done in the same room as the urinary flow rate. You will be asked to lay upon your back, and a technician will place a ultrasound probe on your lower abdomen and measure the volume of urine that is left in the bladder. Again, the results are calculated immediately after the test, and you will have the results of both procedures before you leave the office. I hope you will find this video helpful and useful to help you understand the purpose of the urinary flow rate and the bladder ultrasound. Should you have any additional questions, please do not hesitate to go to my website, www.neilbaum.com, or contact my office at 504-891-8454. Thank you.